One of the most common cancers in men is also one of the most curable, but early detection can make all the difference when it comes to surviving prostate cancer. Today, Dr. Christopher Brede, part of the Spectrum Health Cancer Center team, is here with us. And you know, we talk about prostate cancer, but there are a whole lot of other issues involving prostate health that you help your patients with.
Right, certainly. Prostate cancer just being such a common cancer among men, about 1 in 7 men will be diagnosed with prostate cancer in their life. But we also don't want men to forget about their other symptoms that may be involved with their prostate, may not just be cancer symptoms.
And so when you talk about prostate cancer, that itself, it tends to be more for older men.
It can be for older men, but in general, we start screening for prostate cancer around the age of 45 to 50 for most men.
Okay, so let's talk about some of those other issues involving the prostate.
Right. Prostate is involved in urinary issues and in sexual health issues as well, and these are important topics that men often do not talk about, sometimes with their primary care doctor or even with their family because of the embarrassment maybe associated with it, or they just push their health off to the side.
And so you talk about different treatments and different procedures that you can do if you intervene with somebody at an early stage. What are the symptoms? What would men experience, or are there symptoms that people would experience?
Yeah, there are often significant symptoms with prostate health, and specifically when we talk about enlargement of the prostate, which is a very common condition that men experience as they age. From general enlargement of the prostate gland, we can have frequency of urination at night, hesitancy of your stream, or slowing down of your stream are often the common things that we see.
And then you talked about some sexual issues as well. That can also be a red flag for some men.
It can be, and these sexual symptoms come up often, are rarely talked about, and that's another thing that we want to make sure that guys are aware that we are here to help with those symptoms. Okay,
so if somebody is experiencing any kind of an issue involving their prostate health, what kind of screening do they go through?
Oftentimes it starts with history and physical examination, and that can be with their primary care doctor, and we often see guys specifically for this often on like a self-referral basis also. So after their history and examination, there are lab testings and other screening exams that can be performed.
And then if you find that there is an issue, is earlier treatment better at maybe preserving the health of the overall area?
Yeah, that's correct. Oftentimes treatment is delayed because of some of these issues we talked about, but the prostate health can affect other areas of life like sleep and cardiovascular health as well. So earlier treatment is better.
Okay, so let's talk about information, because I think that's really an important part of the equation. I know at Spectrum Health you really try to get the information to patients and future patients in a lot of different ways, including this Doctor Dialogue series you have coming up.
Well, we're having an event on November 2nd where patients and their family members, we encourage them to come as well. Oftentimes patients need an advocate for themselves, men and women, right?
Often.
And so we encourage families to come, men and women. On November 2nd, we're having this meeting. It'll be myself and 2 of my partners. I'll be talking about prostate health in terms of enlargement of the prostate. My partner, Brian Lane, will be talking about prostate cancer, screening, detection, and my other partner, John Humphrey, will be talking about sexual health.
You know, we were just talking a few minutes ago about Ben Stiller, famous actor, really funny comedian, fairly young guy, recently diagnosed with prostate cancer. That's got to have a lot of people thinking and at least starting that conversation.
Yeah, certainly an impact, and that's one of the controversies right now surrounding prostate cancer. We can help shoot up some of those discussions at this dialogue as well.
Okay, so when we talk about coming to that event, do people need to RSVP? Can they just show up that night?
We would prefer if they register online. We'll give a website here where you can go to register for the event, just so we know, but certainly showing up 6:30 to 8 o'clock on November 2nd.
And if somebody's interested in getting in touch with you, maybe for an exam, some information, you don't need a referral from your from your primary care doctor.
Correct. Yeah. Just please give us a call. Any concerns about prostate cancer or just having that discussion about prostate health in general, be happy to see people.
Thanks so much, Dr. Brede.
Thank
Great
you.
information. And stay right there. More of 8 West when we come back.
Are you West?